Greetings to everyone who's watching this webinar. The webinar is on what on the surface seems like a rather simple notion, that of education and skills training for parents. And yet this relatively so-called simple assistance to families is one of the few very powerful and evidence-based interventions that we know works and can promote mental health and resilience, not just in children and teenagers, but in their families, and lead to improved family functioning, improved parental mental health and well-being, and reduction in family stress. In particular, we're going to talk today about the importance of education and skills training programs for parents who have children who have developmental problems. Whenever we look at a child who has developmental problems, we're interested in what can we do to help their behaviour to be as well adjusted as possible and to improve their well-being and build their resilience. Now, that's a complex process. We know that our behaviour and our development is influenced by many factors. At its most basic, it's clearly influenced by biological and genetic factors. For example, the child might have Down syndrome, or the child might have an autism spectrum disorder. And these have a biological basis. There are genetic factors that influence the development of these processes. The other factor that might influence the child's interactions with the world is their developmental level, their intellectual capacity. We know that for some children with developmental difficulties, they may be aged 6, but their development is more around the age, for example, of a 3-year-old. And that's something that has to be taken into consideration. We also know that children thrive when they have good educational opportunities and when there's early intervention to assist them in their development, not just for the child, but their families. We know that the child's temperament or character, which is sometimes inbuilt into them, is a very important factor that contributes to their resilience as well. We know, for example, there are easy and difficult children. We also know that if the child has mental health difficulties or emotional and behavioural problems, that significantly adversely affects their behavioural adjustment and well-being. And finally, we know that children are very heavily influenced by their social family experience, by the experience of care they receive, and by the attachment relationships. And this is this last one that I want to focus on. I want to focus on what can we do to support families to care for their children who have developmental difficulties. Families of children with disabilities need support. Well, there's very good evidence, and my team has contributed to some of this, that's showing that if a child has a developmental difficulty, then at least 40% of those children, and usually more, have significant behavioural and emotional disturbance on top of the developmental difficulty. And these emotional and behavioural difficulties or mental health problems are already present by the age of 5 and are often evident from very early in life, certainly in the first or second year. Now, that rate of emotional and behavioural disturbance is at least 3 or 4 times the rate of what you would see in typically developing children. In other words, this is a very significant issue, and that's a major reason why children with disabilities need support. The behaviour and emotional problems in developmental difficulties is not a phenomenon that children grow out of by the time they reach young adulthood. We've got evidence that these difficulties, if they're not assisted and helped, continue and persist and become more complex. And this is a very high cost to society. These children cost our society significant amounts of money in their care, their education, their adjustment, and their engagement with the community. And they're a huge burden on the family, which is also a high cost to society. The parents and caregivers of children with developmental difficulties experience significantly greater parental burden, stress, and mental health difficulties, which is associated with their child's behaviour and emotional problems. It's not the cause of their child's difficulty, it's a consequence quite often of the child's developmental difficulties, placing very significant stress on the parents. So how can we help? Recognition of developmental problems brings a multitude of questions about what to do next for parents. Parents need to make very important decisions about their child's education and management and treatment, and about a whole host of other family and community responses and attitudes. We do know that treatment or assistance for emotional and behavioural difficulties in developmental problems should begin as early as possible and must be tailored to the child's profile of symptoms, their behaviour, their strengths and their weaknesses, the way they learn, the way they communicate, the way they respond to the environment, and their care needs. Now, with that in mind, there are in fact a variety of evidence-based early interventions that are more likely to promote development, improve behaviour, and reduce the stress experienced by the child and family. What I'm going to talk about today are the evidence-based programs that are focused on providing parents with education and skills to better manage the child's developmental difficulties and the specific difficulties they present with. Now, what do I mean by evidence-based? I don't mean testimonials where somebody said, oh, this has really helped me. I don't mean something that sounds like it might be a good idea. I don't mean something that somebody on the media has said, hey, listen, guys, you should do this with your children. What I mean are, in fact, interventions that have been tested and trialled and compared against those children who haven't had those interventions but have exactly the same difficulty. In other words, where we've got clear evidence that the addition of this intervention, the addition of a parenting skills program, leads to better outcomes than might be expected by chance or without that intervention. So there's no doubt that most families of children with developmental challenge, such as autism spectrum disorder, ask for help and support. Stresses can be present, whatever the severity of the child's symptoms, and most parents are asking for help. So why a family-based intervention? Well, in the family-based interventions I'm talking about, parents and other family members can learn about their child and how to play, interact and communicate with them in ways that promote social skills, which promote positive behaviour and which help develop the child's daily living skills. Now, in turn, this reduces parental stress and improves their well-being. There's a photograph here of parents who've given their consent for the photograph to be shown, who are members of a parent education and skills training program, a group session, and they've all got children who have an autism spectrum disorder. Now, what are some examples of evidence-based programs that can improve child outcomes and reduce family stress? I'm going to give you some examples of these. And the first of these is a program called the Stepping Stones Triple P program, the Positive Parenting Program for children with developmental difficulties. The Stepping Stones project was a project that, in order to gather evidence for its effectiveness, was funded by the National Health and Medical Research Council and involved researchers such as myself from Monash Centre for Developmental Psychiatry and Psychology, from the University of Sydney, Professor Stuart Einfeld, and from the University of Queensland, Professor Matthew Sanders and Kate Sofronoff. Now, what is the Stepping Stones Triple P program? It's a multi-level parenting and family support program for families of children with disability. It's adapted from another parenting skills program, which you might have heard of and which is very common and easily available throughout Australia, called the Triple P system. And that's for families who have children who don't necessarily have disabilities, but might be presenting challenges to their parents. Now, when we started our assessment of this program, there was already considerable evidence published in the literature that the Stepping Stones program was an effective intervention for improving child and parent outcomes in families of children with disability. It's for children with a range of developmental difficulties, such as autism spectrum disorders, intellectual disability, a range of genetic abnormalities, and so forth. It's for children aged between 2 and 10 years of age. In other words, it covers most of childhood up to the teenage years. What do I mean by multi-level? There are various levels of intensity of intervention that families can join. For example, the Stepping Stones program is talked about in the media. You can go to the Triple P website and get some information on the program and some tips, and that in and of itself can be helpful for some simple difficulties. There's a level 2 advice in which parents attend seminars or online seminars, like a mini conference in which they can listen to the therapist talk about how to raise your child who has a developmental difficulty. And this advice is occupying maybe an hour or 2 of your time, and the advice is brief, and that too can be helpful. The third level is where a family engage with the program for 2 or 3 sessions to have parenting support and advice around a specific problem. For example, they might have a child who's got developmental delay and has very serious problems with sleep. Their sleep is disturbed, they can't get to sleep, and that's creating a lot of difficulty for the families. That might be the problem that you would focus on in the narrow focus parenting support component of a Stepping Stone system. And again, that support is available either online or by attending a therapist face-to-face. The usual program, and this is the one that we investigated in particular, is level 4, where families come either as a group or individually to the therapist for around about 8 to 10 sessions. And this again is also available online. So families can sign into the Stepping Stones program and engage online with this level of support. There's also a final level of support where the family intervention is very intensive, and this is for families who have very serious difficulties with their child or very complex family structures. For example, the child might be in foster care. So now, in fact, when we ran this trial, we made it available across Queensland, Victoria, and New South Wales. And to date, over 3,000 families have participated. In other words, we've got a big database to show that it's effective. And what were our results? Very clearly, we demonstrated that child behaviour and emotional problems decreased significantly across the course of the intervention, but most importantly, these gains were maintained 1 year later. And in fact, in some other follow-up studies, some gains can be shown to be persistent for more than 3 years. In other words, the child's behaviour improved, their adaptation improved, and they were doing significantly better, even though they still had their developmental difficulty. There was also significant decrease in parental depression and anxiety, and a significant lowering of parental stress and an improvement in parental well-being. We were able to show that the parents' skills improved, particularly with their consistency of parenting, their ability to use positive encouragement, and to support and care for their child. These improvements were also maintained a year after the program. Now, most importantly, we're also able to demonstrate that this intervention was of cost benefit to the family. In other words, money was saved, both in terms of utilisation of services, but also a very interesting one, and it was more likely that parents were able to go back to work after the program, whereas beforehand they'd had to stay at home because of the emotional and behavioural difficulties that their children had. This is just an example of some of the science behind our claim that we have evidence. It's a score on a child behaviour checklist called the Developmental Behaviour Checklist, which showed the overall level of emotional and behavioural problems the child had. At the left-hand side of the slide, you can see that the children in the program had really significantly high levels of emotional and behavioural difficulties. That's in the clinical range. After the program, you can see that there's a fall in the level of emotional and behavioural problems for many children no longer in the clinical range. And what's more important, over the next 12 months, there was no change in that level of emotional and behavioural problems, meaning that there was no deterioration, that the gains in emotional and behavioural difficulties, improvements in the child behaviour that the child demonstrated in response to the parental interventions were maintained at 1 year follow-up. Here's one example of improvement in parents. This was a questionnaire we used to assess whether the parents were suffering from depression. And again, this slide shows that over the course of the intervention, over the course of the family meetings, parents became significantly less depressed. And in fact, this improvement was maintained over 12-month follow-up, meaning that the improvement in the parental mental health was sustained even after the program finished. So what are the key take-home messages from this investigation of the Stepping Stones Triple P program? It can be successfully implemented in the community with community-based practitioners providing the intervention, and it's also available online. There were clear improvements in child behaviour and emotional problems. There were improvement for parents. They were less depressed, less anxious, and much less stressed. And there was certainly improvement in parenting skills. I want to move on now to another example of a parenting education and skills training program for children with autism, which is also evidence-based. This program is called the Preschoolers with Autism program, which has been around now for quite a few years. Was designed by my colleague, Associate Professor Avril Brereton, and myself. It's evidence-based, meaning we've investigated its benefits on a scientific basis. A 20-week program with 10 group sessions for the families, that's 90 minutes fortnightly, and 10 individual sessions on alternate fortnights for the parents. There's also a version available for teenagers or families with teenagers with autism spectrum disorder, and also a program for families who have young adults who have moved on from school and who are in post-school options. There's also a program for grandparents. And some of these programs are also available online. There's a manual for parents and a manual for the clinicians who are running the programs. Now, what does this program look like? In other words, if you're a parent, perhaps coming to a parent education and skills training program, what sort of issues might you think about and talk about in relation to your child? Well, the first session is educational. That is, we help to increase the understanding of the parent about what is autism. What does their assessment report really mean? What does the diagnosis mean? How is it arrived at? Parents have a lot of questions usually about the assessment of their children who have autism, and it gives the parents an opportunity to talk about that, to get it off their chest, to come to understand what some of the words mean around autism, and to come and understand what ways forward might be open for them. In the second session, they talk about these issues, how it's impacted themselves, how they're feeling, what their emotional reactions are, what impact it's been for them having a child with a developmental disability or difficulty such as autism. It's a chance to share with other parents some of these feelings and to realise that they're not alone, to receive support from each other under the guidance of the therapist. In the third session, we look at how to understand and manage difficult behaviour. And this is a big focus for parents. How do I stop my child having meltdowns when I say he has to come for dinner? Or how do I help my daughter manage becoming very distressed and frightened when it's time to go to bed? We help the parents understand the meaning of these behaviours, how to analyse them, to understand the antecedents of the behaviour, what led up to it, to look carefully at describing the behaviour, and then to look carefully at what is the parent's response to that, because perhaps just inadvertently, the parent might be rewarding the difficult behaviour, even though they don't mean to. In session 4, we move on with some homework and the parents work on how to change some of these existing behaviour. And they keep logbooks and they look at whether their interventions that they've developed are working. That's the 5th session too, how we encourage new behaviour, how we move children on to develop more adaptive and socially positive behaviours, how to learn new behaviours. Then in the next session, we move to another problem with autism, and that is communication. We look at how to communicate with our children with autism who are verbal. And importantly, in the next session, how to communicate with our children who have autism non-verbally, using, for example, picture prompts or gestures. And this is 2 very important sessions because it helps the parents understand the social communication difficulties that all children with autism have, regardless of how intellectually intelligent or otherwise they might be. Then in the next session, we look at the social problems faced by children with autism, because again, all children with autism have difficulties with their social interactions. And we look at a whole range of strategies that can help children improve their social skills, how they can join in socially more effectively, how they can be encouraged and taught to understand the behaviour of other people who are interacting with them. And then in the second last session, we bring together a lot of these learnings and we look at how parents can help their children work and play together. Finally, the last session is a review of what parents have learnt, where to go from here, and quite often following this, parents decide that they are going to, in fact, continue to meet as a group from time to time because they've developed friendships and contact with other parents who have children with the same difficulties. So that's an idea of what a parent might experience in this particular program, but it's got some similarities with most other parenting programs, in fact, even for parents who have children with other developmental difficulties than autism. Now, here's a little bit of evidence that the parenting Children with Autism Program also works. It's a little bit complicated because we had two intervention groups. We had the red line group, which was where we just gave parent education to the parents, and the blue group where parents also received behaviour management strategies, and the green group were children who didn't have the parent education and skills programs, but they were just having management as usual in an intervention program of some form from their community. Now, what this shows at the start of the program, in fact, there's quite a scatter of abilities in these children, but it's very clear statistically and also in terms of, in reality, that the children who received both the parenting education program and the parenting education and skills training program improved significantly after the treatment, and that this maintenance in parental mental health continued for 2 years of follow-up compared to the control group. In other words, this was a very effective intervention assisting parents in their own mental health difficulties. Another example of this is in parental perceived stress. The parents who received the interventions, either intervention, their stress levels improved significantly at the end of treatment, and that this improvement was maintained for 2 years after the intervention, compared to the families who received no parenting education or skills training program. In fact, their stress level remained pretty much the same, might have even increased a little early on, but certainly over the 2 years had not reduced. What happened to the children? Well, again, what we were able to demonstrate is that there were significant improvements in the child's ratings of autistic symptoms at 1 year follow-up after the treatment, and that this improvement was maintained at 2 year follow-up, where in fact for the control group, those children's autistic symptoms even increased 2 years later compared to where they were at the beginning. In other words, this relatively simple intervention of parent education and skills training has lasting effects and benefits on the child's overall adjustment and the severity of their autism symptoms as expressed in their emotions and behaviour. Next, to move on to some brief examples of some other effective parent education and skills training. There's a very interesting one currently under review and under an experimental program, a research program at the University of Sydney. It's called ParentWorks. And again, this program is offering parents participation in an evidence-based parenting skills and training program which can be done online. Now, that's very important considering the COVID and pandemic restrictions that our society is facing at the moment. In other words, parents might say, well, I can't leave the house and get out to attend a group or to see a therapist face-to-face. Well, ParentWorks Spectrum offers this opportunity so that parents can do a parent education and skills training program which has some evidence for its effectiveness online from the convenience of their home or another convenient place for them. Obviously, looking at that slide, it's very dense. There's a lot of information there, but basically, if you're interested in that, then it's very simple. You just use a search engine to look up ParentWorks Spectrum, and you'll find a website associated with the University of Sydney, and you'll be able to inquire about how you might be able to join this program. If you have a child aged early in life, between the ages of 2 and 6, you may be able to join that program and benefit from the work that you can do in the program. So that's one example, Parent Work Spectrum. This is another slightly different program, which comes from Melbourne. It's been designed by Professor Sophie Havighurst and Anne Hartley at the University of Melbourne, and it's called Tuning In to Kids. Now, they offer a range of programs which help parents become more alert to the emotional expressions of their children and how to respond to signs of emotional distress or behavioural difficulties in their children. This program is also available online, and it's for parents or carers of young children in primary school age and preschool age, for adolescent children or teens. There's a program specifically for fathers to work at, which is, I think, very helpful, because we fathers sometimes feel we're left a bit out of this process. And I should say, just as an aside, all of the programs I've spoken about in this webinar include parents, both mothers and fathers, if they're available. And there's also a program for toddlers in the Tuning In to Kids suite of offerings. Now, again, if you're interested in finding out about this program, all you need to do is to consult a search engine and put in Tuning In to Kids, perhaps University of Melbourne, although that wouldn't be necessary, and you'll come up with a very helpful website, and you'll gain more information about that program. The final example I want to give you is one which is rather special. It's called the Building Early Attachment and Resilient Program, or the BEAR program. It's a program which is a program supported and collaboration between the Mental Health Foundation Australia and also the University of Melbourne. In particular, Professor Louise Newman is the lead in this program, and it's been supported by significant funding as well from the Pratt Foundation. Now, this is an evidence-based program for parents to be, in other words, parents who are expecting the birth of a baby and who are having some difficulty facing how they might be parenting. They might have mental health difficulties, they might have anxieties about facing parenthood, or they may be in extremely disadvantageous environment. For example, they may be refugee families, or they may be families where there are drug or alcohol problems, or poverty, or other difficulties. It's also a program for parents of recently born children, in other words, in the postnatal period. What does the BEAR program do? It covers a range of early intervention, parenting and infant programs which all focus on supporting attachment relationships and a healthy emotional development in the child, and the building of resilience in those new babies, as well as supporting the mental health and well-being of the parent. It covers groups in pregnancy, early parenting groups, and specific needs groups, which I've already mentioned. And this program has been designed for face-to-face administration, but is also now available online. The programs are designed to be used by a variety of health professionals in hospital and community settings. So we're training a whole range of therapists, such as maternity and child health nurses, and training is being run out for staff in group programs as we speak. Again, if you're interested in finding out about this program, all you'd need to do is go online and put in BEAR, B-E-A-R, program, and you would come to a website and to be able to find out all about it. The program is being run by Professor Newman from the Albert Road Early Parenting Clinic and Program. We're talking about getting in early. If we can reach children with developmental problems early in life and help with the management of any emotional and behavioural difficulties they might have, then that makes a big and lasting difference. Education-based education and skills training programs for parents and carers of young children with a range of developmental difficulties such as autism spectrum disorders, attention deficit hyperactivity disorder, and developmental delay provides significant, lasting improvements in parental mental health and adjustment, and improvement in behaviour and adjustment in the children. And most importantly, we've demonstrated that they are of economic benefit, and this certainly justifies their addition to early intervention programs and to programs, for example, funded by the National Disability Insurance Scheme. Thank you very much for listening, and I hope you found this interesting, and there will be the opportunity for some questions and answers. If anything I've talked about has troubled you and you would like to seek further help, here are some helplines. There's our own Mental Health Foundation Australia helpline. There's Lifeline, Beyond Blue, Kids Helpline, and the Australian Childhood Foundation.